If you see the clinical presentation of lower GI bleeding, there can be two common presentations. One is severe hemorrhage and the second is minor bleeding. What are the causes of severe hemorrhage? One is diverticular disease, which is the overall most common cause of lower GI bleeding. And when in vascular lesions, there is severe hemorrhage. So severe hemorrhage, it can occur with diverticular disease. If the patient is having diverticular disease, it can lead to severe hemorrhage, or patient is having vascular lesions. So in such cases, what happens? There is severe hemorrhage. But you know that minor bleeding, it is because of anal fissure or hemorrhoids. So what's the cause of minor bleeding? It is because of anal fissure or hemorrhoids. Anal fissure or hemorrhoids. Clear?